Hello, my name is Alison and I'm one of the midwives on the elective section team at Caesarean General Hospital. This is a very condensed version of the education session that we offer you when you are going to have a planned caesarean. But we just also want to give you some important updates as well. So elective caesarean births are normally performed about 39 weeks. Sometimes if you have an underlying health problem, this will be brought forward and this will obviously have been discussed with you. Now you will be sent a date for your caesarean in the post. Normally we would be sending you a date for your pre-op appointment where you would normally come to the hospital, but as things are at the moment, we're not doing this in person. You will be contacted by telephone. You will be given a number of the Kettering Borough Council offices where you will need to go for your pre-op bloods, and you will ring and make that appointment yourself. Your blood forms will be there waiting for you. And this will usually be 2 days before your caesarean. Now, some of you may go into labour before your caesarean date. If this happens, if you start having contractions or your waters go or there are any concerns at all, you ring delivery suite, you tell them that you are a booked caesarean and they will invite you in and assess you, and then a full plan will be made for the safest and best way to deliver baby. Now, the day before your caesarean, you will be contacted by someone on the team who will be asking you if you or anyone in your family has any symptoms of coronavirus. If you do answer yes to any of those questions, and the midwife will then go away and discuss with the consultant and another plan will be made for you. Please be aware that your partner is not permitted onto Rowan ward at any time, either before the baby's born or afterwards. So when you come into the hospital, you will be coming in alone. We realise that this is not ideal, but this is the way we have to do things at the moment. But if you know about it beforehand, then you can get your head round it and then you can kind of come to terms with it. He can, however, come into theatre and into recovery. So when we know more or less what time you're going to go to theatre, then obviously he can make sure that he's around. Night before your operation, you can eat what you want up until midnight. I always advise ladies to have a snack or something to eat just before you go to bed, so that you've got the least amount of time that you're empty as possible. From midnight, nothing to eat, but you can drink. You can continue to drink water and squash, and in fact we encourage that as much as possible to keep hydrated right up until you go to theatre. On your delivery day, you need to attend Rockingham Wing at 7:15 in the morning, and on admission you will be screened. If all is okay, you'll proceed to Rowan ward, where you'll be greeted by one of the midwives on the elective section team. It's really important to bring everything that you need for yourself and your baby when you come in, because as I said, there is no visiting. Therefore, if you run out of something, it is much more difficult for anybody to be able to bring you something. On admission to Rowan ward, you'll be asked to shower in the antibacterial solution, and you'll then put on your gown and your embolytic stockings. You will also be given your pre-op medication to take. A set of observations will be done, and we'll listen into baby, and we'll complete a checklist. The surgeon who's doing the operation will come and see you, and the anaesthetist also. Your consent form will be signed at this stage if it hasn't already been done. We won't be able to tell you on admission what time your operation will be. At about 8:30, 9 o'clock, we have a meeting with delivery suite and theatres, of which we assess what is happening in the unit, and then the order of caesareans is then decided. Because we share theatres with delivery suite, if there is an emergency, then they will always take precedence over us. So if there are a number of emergencies, then the elective sections keep getting put back. Occasionally, if there are 3 or 4 elective sections in a day and lots of emergencies, there is the need to cancel elective sections. Obviously, this is not ideal for you, it's not ideal for us, but sometimes it is unavoidable. If this is the case, then you will be brought back the next day to have your caesarean. So when you're ready to go to theatre, obviously your partner will meet us down there, and he will be instructed where to get changed into his theatre clothes. On arrival in theatre, a cannula will be inserted in your hand and a drip will commence. The spinal procedure will then commence, your back will be washed and the spinal will be put in. This starts to work very, very quickly, so you start to feel numb and tingling sensations very soon afterwards. The midwife will then listen into baby's heartbeat, and then a screener will be put up in front of you and the catheter will be put in. You shouldn't feel this at this stage, you should be quite numb. The caesarean will then commence. You may feel pushing and pulling and sensations, but you shouldn't feel any pain. And it is important, if you do feel any sharpness, any discomfort that is not right, then you need to let the anaesthetist know. The baby usually is born within about 10 minutes from the start, and occasionally this can take longer if you've had previous surgery. If you've had a number of caesareans, there's likely to be more scar tissue. We do like to practice delayed cord clamping for a minute. So if baby's condition is good, then we will allow baby to just lie there for a minute, and then the cord is clamped and cut and put in a sterile cot. The midwife will then bring baby up to the top end where you are and your partner is, and baby will be dried and assessed. The plastic cord clamp will then be applied, and if your partner wishes, he can cut the cord. Baby will be then weighed and will be given its injection of vitamin K with your consent, and this will have been discussed with you beforehand. Baby's then placed skin to skin with mum or dad if that is what you would like. Then obviously the operation is continuing during this time of sewing up. When this is completed, you are then moved onto your bed and taken to recovery. Again, your partner can attend with you. Skin to skin is encouraged and continued at this stage, and whichever method of feeding you would like, then you will have assistance with this. When you will be transferred to Rowan ward after about half an hour, and as I said earlier, this is when your partner will need to then leave. He won't be able to accompany you. On arrival to the ward, you will have a drip in your hand and you will have your catheter in still. And you can start eating and drinking almost straight away if you feel like it. We will encourage fluids, however. You will have observations done every half an hour for the first 4 hours, and then 4 hourly after that. You will have some analgesia from your spinal for a number of hours, but as soon as this starts to wear off, as soon as you start to feel any pain at all, it is really important that you ask for pain relief. If you can have pain relief right from the start, then your recovery is so much better. You can get up and get moving so much better. So after 6 hours, the spinal anaesthetic is worn off. Then we get you out of bed, we take your catheter out and we walk you to the washroom where you have a freshen up and put your own clothes on. And then when you have passed urine, then we'll take the cannula out. Obviously, because your partner isn't going to be there, you are going to need a lot more assistance from the staff on the ward, and this is really important that you ask for it. Do not struggle. You are going to find it difficult to get baby out of the cot on your own and to manoeuvre yourself for the first few days. So it is important that you do ask, and we're willing to help you with this and with feeding, of course. And if all is well with you and baby, then you can go home after 24 hours. So in the meantime, whilst you're waiting for your caesarean, it is really, really important that you keep a really close eye on baby's movements. Do not think they're really busy at the hospital, there's all this stuff going on, I don't want to disturb them. If you are worried about baby's movements or worried about yourself with any health issues, you need to ring Fetal Health Unit or Delivery Suite. So I'd just like to wish you all the best, and I may see some of you later on when you come in for your caesareans. Thank you, take care.